Hey everyone, this week we'll be discussing implementing change strategies. The general system that we'll be using is the task-centered system. We first talked about the task-centered system, not necessarily in this name, but in the system with contracting and goal setting. So setting tasks is a strong component of that same process. So task-centered system is where social workers and clients together come up with goals and tasks to target specific problems. So again, these goals and the tasks should be agreed upon by both individuals. This system is used well within a brief time limited period. So it's frequently used when you have clients who may be coming in for a few months, a few weeks, a few times that you're meeting with them because you set specific end goals and end dates and tasks that they're going to work on along the way. It's really a systematic process of moving clients towards a goal, one task at a time. And some of the central tenets include that the problems have to be identified by the client. So it can be really challenging to use if a client doesn't agree that a certain problem exists. The other thing is that individuals are really capable of solving their own problems. They just need the social worker there to guide them. So they need assistance to work through that process, but ultimately they have the resources to solve their own problems. So when we think again about the task-centered system, this is really in line with what we discussed previously with goal setting and contracting. The first is that you identify the target problem. The next is you develop the goal from the problem. And from the goal, you start to develop tasks and you implement those tasks. And then you are going to be monitoring progress along the way. The thing to keep in mind is that you are going to set multiple tasks for clients. In the specific situation that you're doing with your partner project, you have two general tasks that you have to be working on with multiple partialized tasks representing each general task. And you might not necessarily be working on each task at the same time. It may be that you finish one task completely before moving on to the next. It may be that there's two tasks that they might be working on. You really have to gauge what's going to be most effective for the client. You know, some clients, it's just not going to be feasible for them to work if you have them kind of working on multiple projects at the same time. Sometimes it can be helpful to have the client start with easier tasks. That is your first lecture quiz question. So if all tasks are of equal importance, which ones can be helpful to start with? And a lot of times it can be the easier tasks, things that might not take as long, because in that respect, clients can have that feeling of accomplishment. They were able to finish something. It's going to build self-confidence, feelings of self-efficacy. So by the time they get to those more challenging tasks, they feel like they can be successful and they'll be more motivated to work on those more challenging tasks. However, there certainly may be situations where you might need to start with harder tasks. There's going to be tasks that just might be of more importance in general if you're working with an involuntary client, things that have been kind of identified by the court system, or things that have been identified by the client as being of greater importance. So you need to make that decision in line with the client on which tasks you're going to start with. However, sometimes it is easier to start with the easier tasks, or it's better for the client to start with the easier tasks just to enhance those feelings of confidence. Once they've started implementing tasks, that's when you're going to be monitoring their progress in completing the tasks. So if we think about your partner project, again, meeting number 1 is when you conducted the assessment. Meeting number 2 is you started planning with the goal setting and contracting. Meeting number 3 is where they're going to start implementing the tasks. And then in meeting number 4 is you're going to be monitoring their progress. However, there's going to be components of implementing tasks and monitoring their progress in both meetings 3 and 4 because they will likely be implementing tasks starting at different points in time. So as an example, when we're thinking about implementing tasks, we're going to use our example from the past when we talked about Katie. So Katie was a student who wanted to be stress-free before a test, so she was having a lot of anxiety before a test. So this is just an example. Her general task was to practice relaxation exercises before a test. Her partialized task was to do deep breathing for 5 minutes the morning of a test and to practice yoga for 1 hour the night before a test. So again, as a reminder, we have our general task, which provides the general direction for actions. And then within each general task, we have partialized tasks that lay out the specific who, what, when, and where, and how for the action steps that the client needs to complete. And it's important that we have these partialized tasks because it tells the client exactly what they're supposed to be doing. So when we are implementing, in the process of implementing the task, some things that you need to be thinking about and working with the client in that moment in the session, the first is you need to be enhancing the client's commitment to carry out a task. So it's important that, number one, the client is aware of the benefits of the task. So sometimes when you're working with a client, the goals and the tasks, again, they need to be agreed upon, but sometimes when you're brainstorming tasks for clients to complete, you might be offering suggestions. So when you ask a client, what do you think would be helpful for you to be less stressed before a test? They might not have a lot of ideas. They might need you to help guide them. And sometimes some of the tasks that you recommend may not be necessarily things that the client is interested to work on. So that's why the first part of that is you need to be aware of the client's values and what is going to be most helpful for the client. There's going to be different activities that some clients do really well with and some don't. So if we think about Katie, one of Katie's partialized tasks is to practice yoga for 1 hour the night before a test. So if Katie hasn't done yoga before, if she has, I don't know if it's going to be helpful or not. Some people are yoga people, some people aren't. Maybe it's helpful for you to let Katie know the benefits of doing yoga. So letting her know the research. Oh, you know what? Here's some research on yoga that it really has helpful benefits to making individuals less stressed. So letting them know of the benefits of the task can help enhance their commitment to actually carrying it out. For some individuals, enhancing their commitment might include using like rewards and incentives, especially if you're working with kids. And there's tasks that they need to do that they kind of have to do the task, but they don't necessarily want to. If there's rewards that you can build in, that can be helpful. We're not bribing individuals, but we're using a reward system to motivate them to continue doing the positive behavior. So again, if we're kind of thinking about kids, rewards and incentives can be really helpful to enhance the client's commitment to carry out the task. That is your next lecture, your second lecture quiz question. So think about like sticker charts, like every time, like if you're trying to help Katie's like 15, so sticker charts might be a little on the younger side for 15-year-olds. But if we're thinking about younger kids who might be practicing deep breathing exercises, every time they practice deep breathing, they get a sticker. And after so many stickers, they get a special reward or something to just kind of keep them motivated to keep carrying it out. Because the first thing is we need to know that the client is committed to the task. Because if the client is kind of iffy on whether they want to do it or not, they're not actually going to do it. We've all had things like we've gone to the dentist and the dentist tells us we need to floss our teeth every night. Some people don't follow through on it because if they don't think it's helpful, or for a variety of reasons. So we have to make things easier and ensure we have that commitment from the client. The next step of that is that you need to plan out the specific details of carrying out the task. And that's what you need to review with the client and really lay that out there. So that's when you really are identifying the who, what, where, and how. So if we think about Katie doing yoga, is if you just tell her, oh, go and do yoga for an hour before your test, or the night before your test. If she doesn't know, where to do yoga, letting her know that, hey, all you need is a mat. Here's how you download an app on your phone. Here's the types of clothes that you should wear. Here's some other things to keep in mind when you're doing yoga. If a client's not fully aware of that, they might not follow through on it. So really making sure those steps are discussed in detail. The other part is you need to make sure you've kind of assessed what their potential obstacles might be to carrying out the task, and you've resolved those obstacles. So maybe Katie doesn't have a yoga mat at home, or maybe Katie doesn't have a quiet place to do yoga. Maybe she shares a room with another sister, and so she doesn't have a space to physically do yoga. So those are things you need to be thinking about in advance, talking through that with the client in that session prior to them actually implementing the task, if you want them to be most successful. The final component of implementing tasks is to rehearse or practice behaviors. So in a session with a client, actually role playing or doing some sort of guided practice where they're actually doing it or modeling the behavior, especially if we think about individuals having like tough conversations, whether that be with a teacher, a supervisor, a parent. If you've kind of role played that conversation in advance, then they might be more comfortable with carrying it out. For example, one thing that a lot of social workers do is they refer clients to counseling services. And if you're working with someone who is younger and is receiving their health insurance through a parent, their parent is going to be aware if they start receiving counseling services, if it has to be billed to their insurance. And so that can be a limiting factor for some individuals because they have to have this tough conversation with their parent that they're meeting with a social worker and that their social worker is recommending them to get mental health counseling, because not all individuals are in favor of that because of the stigma with mental health counseling. So it might be that you kind of role play that conversation of how you can talk to your parents about the need for you to receive counseling. And again, having that conversation can be extremely helpful. If we think about Katie, our example, who was supposed to work on deep breathing exercises, to help Katie properly do deep breathing exercises, it might be that you lead Katie in a 5-minute deep breathing exercise in a session together. And then Katie will kind of know what she's supposed to be doing. What does deep breathing look like? Rather than if you just kind of have Katie download an app or give her some directions on doing deep breathing. If you're actually able to lead her through guided deep breathing exercises in the moment, then she'll be more successful. The other thing that you can think about doing is assisting them in the moment. Again, if they're working on a behavior in the moment. So if you're working with a child on proper social skills, maybe you're watching them in the classroom and seeing how they're interacting with other kids. And maybe in that moment, you can work with them and provide suggestions. They have some techniques, especially if you're helping with like parenting. Sometimes they have like a two-way mirror where you watch the parents interact with their kids, and the parents have like a bud in their ear where they can listen to you and you can offer them suggestions, again, in that moment, because you're able to provide them with real-time feedback. And it's going to be most practical when you're actually like watching them do it in person rather than just kind of having them tell you about their experience. Once you implemented the task, that's when you also need to be monitoring the task. A lot of times you're going to be working with clients who, for a variety of reasons, which we'll talk about, they don't actually follow through on the task. We have incomplete tasks, and this is going to happen a lot in your partner project. It's probably going to happen. There's probably going to be tasks that your partner is supposed to be working on, and they're not going to follow through with it. And you need to identify what's the reason that this task is incomplete. Is it specific to the task, or is it specific to the target problem? So again, if we're thinking about Katie, and Katie's supposed to be working on yoga and deep breathing, did she not do the yoga or the deep? If she comes back and tells you that she didn't actually do yoga the night before her test, is it specific to the task? Did she not do yoga because of something about related to yoga, or is it something related to she's not really fully on board with working on the goal of stress management? So let's first look at reasons that people might not complete tasks that are related to the specific task. So the first part is maybe there was physically just an emergency or a crisis situation. Things happen. People live everyday lives where they're just not able to do something because an emergency happened. Maybe the night before her test, Katie ended up really sick in the hospital, and that's why she wasn't able to carry it out. So if it's an emergency or a crisis situation, that would simply be, if it's a legitimate emergency and crisis, then you would just kind of carry over that task to the next session. So that's your third lecture quiz question. So if there's a legitimate emergency that prevents the client from following through on a task, just carry it over to the next session. If you know that this client has kind of followed through on things in the past, and you really do believe that an emergency situation prevented them from completing the task, then I would just encourage them to kind of complete it next time. However, if it's not an emergency, what are some other reasons they might not have completed the task? It might be due to a lack of commitment to completing the task. That, again, if we think about yoga, not everyone is interested in yoga. Just because it works for you or another client doesn't mean it's going to work for everyone. So maybe Katie isn't really interested in doing yoga. So she's just not committed. You haven't fully enhanced her commitment to yoga. That, again, if we think about how we enhance clients' commitments, letting the client know about the benefits, providing rewards or incentives, helping walk through the process with them, completing it together for the first time. It may be that they don't have the necessary skills or resources, so you haven't really identified all of the obstacles and tackled all of the obstacles in advance. So again, if Katie doesn't have a quiet space at home, if she doesn't have proper yoga clothes, that could prevent her from doing yoga. It may be that the task was just poorly specified, that if you didn't tell Katie exactly, the what, where, and how, if Katie doesn't know how to find yoga videos online, that could be poor specification. So making sure all of those details were clearly specified. And that kind of also wraps into just inadequate preparation, that she didn't know everything that she was supposed to do. She just wasn't prepared. Sometimes if clients don't have the necessary documents, if you tell them to go apply for jobs, but they don't know where to apply for jobs or how to apply for jobs, that would be inadequate preparation, all related to the specific task. The positive thing is these are things that you can fix for the most part. You just have to be able to realize and obtain the needed information to understand why exactly they didn't follow through on the task. Because sometimes, depending on the situation, if they're lacking in resources, they might be too embarrassed to tell you. So if a client's not able to afford a yoga mat and that prevents them from doing yoga, that information might be hard to get, especially when we're thinking about financial needs. Individuals just might be embarrassed to tell you something in particular. So that's kind of where building that rapport with a client can be really, really helpful, because they're going to be more comfortable and are going to be more honest with you. However, there's also going to be situations where clients don't complete tasks, and it has to do with they're not motivated to work on that problem, okay? So it might not have anything to do with yoga. It might have to do with stress management for Katie in particular. So in some situations, it might be that client just doesn't acknowledge that this is a real problem. So especially if we're thinking about involuntary clients, people who are kind of forced to be there and don't necessarily want to be there, and they have their problems identified for them by the court system, they're not going to be motivated to carry out the task. And that's where you might be utilizing some of those skills that we talked about in previous weeks, where you are kind of formulating tasks that would be more manageable for the client, that the client is able to kind of they might not fully be on board with targeting this problem, but maybe there's some tasks that they would be able to work on, and you might help them realize the benefits of this task to other parts of their life. It may also be that the client has, they're kind of on the border about wanting to change. So if they have conflicting wants and needs that maybe I want to work on this problem, but maybe I don't. Again, they just haven't, they haven't fully been on board that this is a problem that needs to be worked on. If the client's unaware of the consequences of not kind of tackling a certain problem, especially again, if we think about parents who are involved in the child welfare system. So maybe the parent doesn't fully grasp that if they don't follow through on this task, they're going to lose custody of their kids. Because sometimes, especially when kids are in the child welfare system, their parents are given a whole list of tasks that they have to work on. And if they don't fully grasp that not following through on one of these tasks is going to prevent them from getting custody of their kids, that might prevent them from following through. The other thing is, not necessarily with involuntary clients, but you would have voluntary clients who just don't have a lot of hope for change. So if they haven't been successful in the past, like, oh, I've always been stressed before tests, this is never going to change. They're not going to follow through on the task because they don't have those feelings of confidence. They don't have those feelings of self-efficacy. So again, that's kind of where we're building in. Let's work on something a little easier. Like, let's get them a win-win, a definite success under their belt so that they're going to kind of have that motivation to work on change in the future. The other component of implementing change with clients is remembering your role as a social worker to kind of also be a case manager. When we think about case management, this is where you are helping to coordinate services for clients. So different fields call it different things. Social work, we call it case management, but some call it care planning, some care coordination, or patient-centered care. But the whole process of case management is you are physically linking families to different services based on their need. However, it's not simply you giving a list of potential counselors in the area and phone numbers to your client and saying, go call them. Case management is much more active than that. So it's not just referrals. It's monitoring the adequacy of the service and making sure the client is fully linked and fully on board with receiving this additional service. So if we think about Katie, you're working with Katie on stress management, and you've been able to work with her on some coping strategies. But it may be that Katie also needs some deeper therapy that is going to be beyond your level of expertise or your what you're allowed to do as a bachelor's level social worker. So maybe you need to kind of link Katie with a counselor. So maybe you are kind of working with Katie to identify what type of counselor she might be open to working with, thinking about what her preferences might be, when counselors are available, if she's only able to see someone in the evening. It may be that you know some counselors who you are physically able to call and say, hey, I have this client, let me connect you with them. Because if you simply kind of give her a piece of paper, she might not follow through on that. And if you are physically connecting her with someone you know, it may be that you can kind of connect with the counselor in the future to see how Katie has been progressing in that domain. And that will help you on working with Katie on her specific goal. So again, when we think about case management, it's not just making that referral, but it's following up with the service providers to see how they're progressing, monitoring their progress along the way, and reconnecting them with someone else in the future. In some instances, they need a referral from a social worker. So in some, like to receive certain government benefits or certain services from other nonprofits, having that social worker be the one to make the call, follow up on the status of an application, can be really beneficial to moving the client forward in reaching some of their goals. So that is the end of our lecture quiz that's the end of our lecture for this week. So we do have 3 lecture quiz questions, which I discussed throughout the lecture. So please reach out if you have any questions.